Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everybody. Good evening for those who are here in Qatar or in the Middle East, and good morning or good afternoon who are joining us from elsewhere on earth. I am Muhammad Ghali. I am Professor of Islam and Biomedical Ethics in the Research Center for Islamic Legislation and Ethics at Hamad bin Khalifa University. It's my pleasure to be here with you in this event and to have this galaxy of speakers with me and to discuss one of the front page issues in our today's world. This event on vaccination ethics and the interplay of science, morality, and policies is makes part or a follow-up of the activity that our research center was doing or was busy with the last 2 days. It was a summer school on vaccination ethics. This summer school was jointly organized in collaboration with Weill Cornell Medicine in Qatar and the World Innovative Summit for Health, WISH, here also in Qatar. Our gratitude to both institutions. Dr. Thuraya Araisi from Weill Cornell and Mrs. Sultana Afdal from WISH have been doing great work in facilitating this collaboration on the summer school. The summer school was accessible only for students who applied for the summer school and whose submission was approved by a review committee. But this event is open for the public. That's why we have bigger number than what we had in the summer school. The speakers today will be asked by myself to say again a little bit of what they said as a starting point of what they said in the summer school, of course, in a way which is maybe much more accessible to the general public. But of course, we will also be very much depending on how things will move forward, depending on the questions that we will receive from your side. You have a chat box. You can write your question in this box, and I'll do my best to cover as many questions as we can and to coordinate this with the speakers. Before I start presenting the speakers, by the way, we have Mrs. Maha El-Akoum from WISH, also one of the important facilitators in the collaboration with WISH. And she unfortunately she was not with us the last 2 days. We had the risk of losing her also today, but fortunately she has some circumstances, but she made it a priority and to be with us, so I'm very grateful for her. We miss Dr. Mu'taz Al-Khatib. I'm afraid in the preparation for this, I didn't realize that he may be flying at this time from his vacation back to Doha. So it may be the time difference. So I'll try to clone him a little bit and to talk about the issues that he was supposed to speak about. Before moving to the speakers of today, I want to submit due thanks in my name and on behalf of CILE to the co-organizers of the summer school, Weill Cornell Medicine in Qatar and World Innovative Summit for Health WISH, and also more particularly to WISH, who helped us in organizing this event and in promoting this event. Very grateful for them. I want also to mention a note about many colleagues in CILE who have been helping greatly for the summer school and for this event. We have a team, a very efficient team in CILE led by Dr. Mawahib Bakr, with her colleagues Amna Al-Ubaidi, Muna Al-Imadi, Rawan Al-Thabata, Badia Tosi, the IT colleagues from the college, and of course my research assistant, Noor Hamwi, who is with us here in this event. So I'm very thankful for all of them and for preparing this. About the speakers of today or the panelists of today, we have Dr. Laith Jamal Abu Raddad from Weill Cornell Medicine in Qatar. And Dr. Laith is professor of infectious disease epidemiology at the Weill Cornell. He's also the director of the WHO Collaborating Center for Disease Epidemiology Analytics on HIV/AIDS, sexually transmitted infections, and viral hepatitis. And Dr. Laith has just recently published two important publications, maybe more, but at least two that I'm quite aware of, about COVID-19 vaccines here in Qatar and their impact on the variants that appeared later on. We will have a discussion about these publications as well. And we have Dr. Khalid Al-Awad. Dr. Khalid Al-Awad is not only a medical doctor, but also a public health consultant with more than 20 years of international experience in the field of public health. He's currently the health protection manager at the Primary Healthcare Corporation, the PHCC here in Qatar, and one of the key figures when it comes to the policies and regulations about vaccination here in Qatar. Of course, we have Mrs. Maha El-Aqoum, head of the Content and Research Fellow at the World Innovative Summit for Health at WISH. She conducted research related to vaccine hesitancy. She will talk about this also throughout this panel. And I spoke about myself. As I said, I'm professor of Islam and biomedical ethics, and I work at CILE, the Research Center for Islamic Legislation and Ethics. So I welcome everybody, and we will start, as I hinted earlier, with a general introduction coming from each of the three speakers. I will follow by the supposedly fourth speaker, Dr. Mu'taz Al-Khatib, later on. But we will start with the general. We start first with Dr. Laith. With a general question. Why should I, as a normal individual, uneducated, I didn't study medicine, I didn't study biomedical sciences, why should I trust vaccines in general and COVID-19 vaccines in particular? Why should I believe that they are safe and they are effective?
Yeah, vaccines, first, vaccines are the most successful medical intervention in human history, period. Thanks to vaccines, life expectancy globally has changed massively over 100 years. This is the century of vaccination. So before 100 years ago, there weren't really mass programs for vaccination, but we had these programs over the last century, and they have been very, very successful. So in much of the world, life expectancy changed between 2 to 3-fold higher now than it was actually 100 years ago. To a large extent, this is because of vaccination, because most children used to die at early age before even reaching the age of 5, because we have lots of infections. But now, from the very first moment a child is born, he or she starts getting vaccinations that protect them. So premature death in childhood very much actually disappeared to a large extent. So they are very, very effective. And they are also very special in the way we develop them. They are being developed using a very rigorous process that starts from studies of different phases. We have preclinical phases, we have phase 1, phase 2, phase 3. Then we get also clinical trials. These are clinical trials. And these clinical trials have the highest and the most stringent requirements for safety, more so than drugs also. Vaccine trials by design the requirements for safety is extremely high. It's actually the highest for the simple reason they are giving to healthy individuals. We cannot risk anything by giving it to a healthy individual. However, for drug development, the clinical trials can allow some side effects if the benefits are much more than those side effects. For example, if we are developing a drug against cancer, well, the person will die from cancer. So we can accept some side effects to this treatment because at the end, these side effects still are less than death from cancer. We cannot accept this for vaccines. The clinical trials, they are given to healthy individuals, and this is why we cannot let any vaccine be licensed unless it's proven in a randomized clinical trial, which is the highest standard of scientific investigation in medicine, that these vaccines are safe. And even things does not stop there. After we license vaccines, we keep doing studies on them on a very large scale, what we call real-world effectiveness and safety studies. These done everywhere. We have done, in fact, several of them here in Qatar as well, where we monitor these vaccines in the real-world scenario and see whether they have any side effects and whether they are, of course, effective or not. So really, there is no question at all about the safety. The side effects are standards. They are usually, most of the side effects are just manifestations of the activation of the immune system. Like I get fever when I get a vaccine. This is because the immune system has been activated, which is in fact a good sign. It means the vaccine is working. Now coming to COVID vaccines in particular. So some people were surprised that we developed them very quickly. The reason why they were developed quickly, because there was massive investment in developing them quickly. There was great need. Billions of dollars were put to speed up the development. And we were actually quite lucky because it happened that at this particular moment, mRNA technology was actually quite developed. So we were able to quickly come up with designs for vaccines. And usually the part of vaccine development that takes most of the time are the clinical trials. Because we have to recruit people, we have to follow them, and so on. Usually these clinical trials don't include a large number of people because they are extremely expensive, extremely expensive. I mean, just to give you an example, typical drug, a clinical trial can cost up to, a clinical trials can cost, for developing this drug, can cost up to $1 billion. So we cannot usually recruit a lot of people. For COVID-19 vaccines, the developers got massive amount of cash in billions of dollars from governments to recruit more people. Because if we recruit more people, we have better statistics. We know whether there are side effects or no. We know if it's effective or no faster. And this helped getting the vaccines tested and the results come out quickly. So in summary, for COVID vaccines, just like for any other vaccines, they are developed using very stringent standard of safety that I can tell you there is nothing in medicine that even come close to that standard.
Thank you. Thank you so much, Dr. Laith. We will come later upon some of the points that you mentioned, but we now move to Dr. Khalid. Dr. Khalid, how does a country like Qatar and maybe other countries here in the region decide on which vaccines we will use in the country and make it available or make them available to the public? And how do we prioritize people who will get the vaccine first? Because especially in the beginning, it will not be available for everyone. What happens? What kind of policies and regulations are in hand?
Yeah, thank you. Thank you, Professor Mohammed. So Qatar have a very strong regulatory process in order vaccination. So as you know that all vaccines are under the umbrella of Ministry of Public Health. And Ministry of Public Health have an advisory committee which called National Immunization Technical Advisory Group. So this National Immunization Technical Advisory Group have a very wide of expertise from different consultants, from pediatrician, infectious diseases consultant, epidemiologist, professors in immunology, and also microbiology and virology consultant, they all meet together in this advisory committee, which is called National Immunization Technical Advisory Group. And usually they discuss the available vaccine in the national Qatar schedule. And this will divide to two, one for children and one for adult vaccination. I'm talking about general, not in case of COVID. I will come to COVID in the end. So this committee usually meet regularly, and they will decide which vaccine will be entered in the Qatar national immunization for children and also for adults, and which vaccine can be taken out. As you know, that children in Qatar, they are mandated to have vaccines according to the national immunization in Qatar to enter school. So if you are entering school in Qatar by age of 6, you have to have all the required vaccine that needed for children according to the national immunization schedule. And as I said, Qatar also have a very strong system as a vaccine registry. It's an electronic system that all vaccine will be entered there. And also they have a very strong surveillance program for communicable disease and for any adverse reaction from immunization. So all these data usually will be with the Ministry of Public Health analyzed and also interpreted, and action can be taken upon this analysis. When it comes to COVID, because COVID is a pandemic, it was taken another approach where Her Excellency have divided 5 committees that have been regulating the pandemic. One is called the Strategic Committee. This is the largest committee where chaired by Dr. Abdul Latif Al-Khal, where different decisions have been taken through this committee. There's also a research committee, which Professor Lacy is part of it. And they are developing multiple research and assessing the situation and variants that we have in Qatar, and plus the efficacy of the vaccine. Also, we have the Health Tactical Committee, which regulate the community response, community engagement, public relation regarding the vaccination, COVID vaccination, and also the status of the disease. And we have Logistical Committee, which regulate all the quarantine requirements and where patients will be. So in COVID in particular, there was formulated a vaccination committee where are they taking decision when to buy these vaccines and how the distribution of these vaccines. So it was a little bit different according to the magnitude of the pandemic. Now, when it comes to the high-risk group, so usually if we are talking general, not regarding only COVID vaccination, usually we have all the time 5 high-risk group that we always care about. We are caring about children below 5, we are caring about elderly above 60, we are caring about pregnant women, we are caring about healthcare worker, and we are caring about also anybody who have comorbidities. So usually these 5 high-risk group, whenever we are doing influenza campaign, any other different campaign, usually these 5 high-risk group will be always there. But in COVID also is different. So in COVID, it will be related to mortality and morbidity, and this means number of deaths and number of people who are getting severe consequences of the disease. And it was very clear in the beginning of the pandemic that elderly people and people who have comorbidity, they were highest risk. And this was upon the recommendation from WHO. WHO is playing a great role giving advices to different countries in the region. And this was the start in the pandemic. In Qatar also, the strategic committee took also some different, upon these groups, there was also different group have been added. For example, according to the epidemiological data, in some time of the pandemic, it shows that the infection is more in schools and among teachers and students, and students were like a vehicle for this infection. That's why it was prioritized that all teachers in Qatar should be vaccinated. So every time the decision of the high-risk group depends on the situation of the disease. If we're talking general vaccines, the 5 high-risk group, they're always there. But if we're talking specifically about COVID, it will depend on the severity, who will be hit more in this pandemic. And upon that, the strategic committee will always take the decision. And after that, all the executive bodies, which is Hamad Medical Corporation or Primary Healthcare or Qatar Red Crescent or any other private or semi-governmental facility in Qatar will enforce these recommendations. Yeah, so this is what I have about the general policies in Qatar.
Thank you. Thank you so much, Dr. Khalid. Again, we will come back to some of these points to discuss them in details. But now we move to Maha. Based on the research you have done so far, we suppose it's very clear that there is hesitancy movements or even outright rejection from some people. Why are still people hesitant about the safety or efficacy of the vaccines? What kind of reasons do they have? And if available knowledge or available research results show us if there are differences, like people in the Middle East may be hesitant for some reasons, people in other parts of the world may be hesitant for some reasons, or are these reasons general? Tell us about the findings of your research in this regard.
Thank you, Dr. Ghali. That's true. I've recently been very interested in the different reasons why people refuse to get vaccinated and the different mitigation strategies that governments and organizations have used to help with this. And of course, like you mentioned, there are general reasons, and then there are also country-specific and religion-specific reasons. So maybe I'll zoom into the Muslim world a little bit through my talk, because that's what my research was mostly about. So as I said, there are a variety of underlying reasons for vaccine hesitancy in general. They differ across countries, they differ across populations, they differ across different communities as well. So much so that we see in some countries, almost half of the population are hesitant to vaccinate. For example, in France, according to the International Monetary Fund, around 60% of the population have reported hesitancy to vaccinate. And in Japan, it's almost the same. But why are people refusing to vaccinate? So what are these underlying reasons that are keeping people from vaccinating? So these range from the concerns over the safety of the vaccines, the fear of their side effects. Some people have even reported fear of needles, for instance, and studies have said that this accounts to up to 10% of vaccine hesitancy. So this has nothing to do with COVID-19. It has nothing to do with vaccines in general. It's the fear of being pricked or having something injected into your body. For some, it's their personal beliefs that's based on their own research and their own experiences, and for others, it's a desire for more information. There's also in the scientific literature this phenomenon called C's, with 5 C's, but I think adapted more. So the 5 C's stand for confidence, complacency, calculation, constraints, and convenience, and then collective responsibility. So if you allow me, I'll go through each of them very briefly. So the confidence is the confidence in the solution itself, or the confidence in the vaccine safety, the confidence in the person that's giving you the vaccine, that is administrating the vaccine, and then there's also confidence in the health system as a wide. And then there's also complacency, which is whether or not people believe that this threat is real, whether COVID is really a threat to their health or not. And then calculation is basically this weighing out the risks and the benefits. So calculating whether the risks outweigh the benefits for you or not, and then based on that, deciding on whether or not to take the vaccine. Constraints or convenience is exactly what it says. It's how easy it is to access these vaccines. That can have an influence over the decision of whether you take it or not. And then collective responsibility is the willingness that you are willing to take this vaccine to protect the larger good, or to help prevent others from getting harmed. But one of the big reasons, and perhaps we don't speak about this enough, is religion. And it's quite a shame, and maybe it's even an easy fix, perhaps. There are a number of things that can be done. So in the US, some of the vaccine uptake amongst Muslim communities, where, if we're zooming into Muslim communities now, were some of the lowest in the country at the beginning. And this got the attention of a lot of local and international media. And most of the concerns, it seemed, that stemmed from these religious beliefs were centered around the components of the vaccines. So infamously, we were speaking about pork gelatin or fetal cell lines. So Muslims were largely concerned with the ingredients being haram or forbidden religiously. But with the help of various community organizations, mosques, cultural centers, religious where religious figures and scholars have personally taken it upon themselves or personally taken the responsibility of exploring and highlighting the issues of the moral discourse around the COVID-19 vaccines. So if we zoom into our part of the world, for starters, the International Islamic Fiqh Academy, which is the global Jeddah-based Islamic institution for the advanced study of Islamic jurisprudence and law, issued a fatwa earlier this year that permits the administration, use, and uptake of all vaccines that were approved and authorized by the World Health Organization indiscriminately, which means that any of the list that the WHO has listed of the authorized vaccines, any of them were permissible for Muslims to take. This fatwa also added that the vaccines can be purchased as part of the obligatory zakat money. So this further encourages people to vaccinate. It re-emphasized also and encouraged governmental authorities to take the lead in making vaccinations mandatory, and went as far as to say that any scholars who disagree or dispute with this were troublemakers. So the participants who took place in these deliberations that resulted in these fatwas were notably from all and various Islamic sects, including Sunnis, Shias, and Badi backgrounds. In addition to this, earlier this year, also the highest Sunni authority in Egypt, which is the Al-Azhar Fatwa Center, confirmed in a statement that the country's inoculation campaign could continue throughout the month of Ramadan, which reassured all of those who had concerns over the vaccine breaking their fast that in fact, no, the vaccine would not break your fast and you could continue to fast and take the vaccine during the holy month. From the Shia perspective, the highest Shia authority, which is the Iraqi-based Sistani, had ruled that Muslims should take all necessary preventative mechanisms, precautions, and treatments as recommended by the scientists and medical experts, and that they, the Muslims, should stay away from any unscientific methods, and we'll return to this in a bit. We've also seen in Saudi Arabia that the country's Ministry of Health restricted the Hajj pilgrimage this year to those who had been vaccinated. Another fatwa from the UAE that Dr. Ghali referred to in his article that was titled Islamic Ethical Perspectives on Vaccination, the Interplay of Science and Religion in the Age of COVID-19, emphasized that it is within the expertise of scientists and scientists alone to determine the safety, efficacy, and overall beneficence of the newly developed vaccines. Another concern that this fatwa addressed was the concern of religiously prohibited substances. So we said before that mostly Muslims were concerned with the components of the vaccines. So in response to this fear, this fatwa stated that all information that was provided by Pfizer and Moderna vaccines indicate that no such materials had been used. However, had they been used, the vaccines would still be permissible, as under the notion that the original material will have undergone some chemical transformation during the manufacturing process, so it will not have retained its original nature. So it was permissible for Muslims to use it even if it contained pork gelatin. So of all of these trusted authorities and religious scholars and experts have helped change the discourse around COVID-19 vaccines. And have undoubtedly caused a shift in the trends of vaccine hesitancy when it comes to Muslims and the Muslim world. Dr. Ghali, I'm sure you'll tell us more about this in your part, but that's it for me from now. Over to you.
Thank you. Thank you so much. Thanks for the three speakers. If I may add some stuff, already Maha started with fatwa discussions about COVID-19 vaccines. During the summer school, I gave a talk about fatwa literature on vaccines in general and COVID-19 vaccines in particular. The discussions among religious scholars on vaccines started with the very first vaccine in the history of modern medicine, which is the vaccine for smallpox, which was developed by Edward Jenner, the British physician, in 1796, the very end of the 18th century. What happened, what historical studies tell us about this is that few years after the development of this vaccine, there was an Armenian Catholic merchant, businessman in Baghdad who was taking care of the business of a rich family there. He moved from Istanbul to Baghdad. This businessman was not only a businessman, but he was also someone who is thirst for knowledge. Had multilingual proficiency, so he knew, besides a little bit of Arabic, he knew Italian and other languages, and Armenian, of course. And he wanted to introduce this newly developed vaccine into Baghdad, the city where he was living in. He was known as someone who has passion for modern scientific advancements, reading the magazines, the newspapers about these issues, travels around the world to know more about this. And it seems, from what I understood, Dr. Laith and Dr. Khalid can tell us more about this. The vaccine was not that complex as we have now, the mRNA vaccines and all this stuff. It just, you need to learn the technique. He did that, and he tried to introduce it a few years after the 1796. And there were failed attempts, as they call it. People were not responding to these attempts from him. And what is mentioned by the historical sources is that al-awham as-sa'ida, widespread illusions. And was particularly mentioned the belief in God's predestination. What God decided, we have to accept it, we have to trust God. But of course, even between the lines, we can read that the novelty of this new way of medical treatment was also an issue, and people were not so happy with that. What he did later in 1810, this was the first big success for this Armenian merchant, Uwanis Muradian, this was his name. He vaccinated his own son in public, so that people will make sure that there is nothing, and the child will not die and nothing will happen to the child. By this, some of the public figures in Baghdad started to believe in the efficacy and the safety of the vaccine. One of them was the chief Mufti of Baghdad at this time, Ahmed Effendi, and he was introduced as Ahmed Effendi al-Hasif al-Ra'i, the wise Ahmed Effendi. Ahmed Effendi, he brought his own children and grandchildren. They were 6 in total. They were vaccinated in public. He himself was vaccinated. And one of the also wise steps taken by Muradian is that he made a template for a testimonial of those who got vaccinated or whose families got vaccinated, in which they say, I am, for instance, Ahmed Effendi, the chief Mufti of Baghdad. I got this vaccination. I'm very thankful for Muradian. They called him Muradian al-Islambuli, the Muradian from Istanbul. And it was very successful. My children were safe. Nobody was hurt, was harmed, etc. And we signed this on this and that day. One of the historians who wrote this, he said himself, he saw these signed testimonials himself. We see here the first encounter where a Mufti, the chief Mufti of Baghdad at this time, was there. A second encounter, also about the smallpox, is Rashed Radha. Rashed Radha is a very famous Lebanese Syrian scholar who was based in Egypt, in Cairo, for a long period. And he produced Al-Manar journal. Al-Manar is an Arabic word which means lighthouse. This journal was one of the most famous and bestsellers in the Arab world at this time, with subscriptions, thousands of subscriptions from inside and outside the Muslim world. Rashed Radha used to publish articles not only written by Muslims, and not only written by those who agree with his ideas, but those also who disagree. But as an editorial policy, Rashed Radha, whenever he sees something quite controversial, he would comment on what is said in a footnote. Between 1926 and 1928, Mahatma Gandhi, the Indian political figure, the very famous political figure. He published the book, A Guide to Health, which was at this time available in various languages, including English. One of the Indian Muslims wanted to translate the book into Arabic and to publish it in a series of articles in Al-Manar. This was between 1926 and 1928. Gandhi, in the 6th chapter of this book, he speaks about the smallpox vaccine. And Gandhi very much against the vaccine. And very much against the vaccine for two main reasons. One, because it's colonial imposed vaccine. It's coming from the British, who are colonizing his own country. And religious reasons that we have to trust God and depend on God and use only nature to treat these diseases. Rashed Radha commented on this in the footnotes that he did. And he said that, first of all, it's not colonial imposed. This is the fruit of science, which can be done by the British or anyone else. So we have to treat it as science, not necessarily coming from whom. And about the religious reservations, Rashed Radha said to Gandhi that this is religious conservatism, where the British conservative people share with you the same opinion. So it's not an Indian issue. It's a religious. So the British conservative people are also against this vaccine developed by the British. And it seems there was a law mandating people to take the vaccine at this time, but the religious conservative people were exempted from this on religious grounds. So he said to him, it's something that you yourself share with the British. And Rashed Radha said that he means the religious scholars, we approach this issue as a medical, technical, neutral issue. So we judge its permissibility or otherwise based on the risk-benefit assessment. If we have more benefits than harms, then we judge it as good. If it's the opposite, we judge it as bad and prohibited in Islam. And he said, based on the testimony of the physicians that we trust, on things that we have observed ourselves, is that the people who received this vaccine didn't suffer any bigger problems than the disease itself when it reaches the people who got it. So the early experience was quite positive about the smallpox vaccine. And we don't see so many fatwas later on after that when we see other waves of pandemics, including the Spanish flu and measles and all the other stuff. We don't see so many fatwas. When we check the collection of fatwas of many religious scholars, it's not a big deal, because it seems they dealt with it, as Rashed Radha mentioned, it's a medical, technical issue to be judged by a rigorous assessment of the harms and benefits. This is something that should be done by the physicians. Only with polio, especially by the end of the 20th century and the beginning of the 21st, we see some big controversies. And with the COVID-19 vaccines, we also other controversies. I will speak about this in other rounds of the question, but this is a kind of introduction to what happens in the Islamic religious discourse about this and what happened in the 18th and 20th century, 19th and 20th century about these vaccines. I started to receive the questions in the chat box, so I myself also prepared some. Before getting into the detailed questions, I have a question which I think is central in the whole debate, which is how to differentiate between a myth and a fact in this. Because this is where it all moves around. And by the way, not only in science, but also in the ethical discourse. Who should we consult and who should we trust when we say, if I'm a Muslim, for instance, and I want to know this is permissible, prohibited, ethical, unethical, who should I listen to when we have different opinions? So I start with Dr. Laith. in vaccines in general, developing vaccines in general, and developing COVID-19 vaccines in particular, where should I go, and what kind of sources should I trust, or people or institutions, if I want to get credible information?
Yeah, so excellent question. So, and really starting from exactly, I liked really a lot your, description, because it really clearly, something like this should be decided. It's a very technical issue. It should be decided by the experts who are working on such technical issue. And for vaccines, we do have lots of, in fact, series of technical bodies that are exactly in charge of establishing this for us. So it's from starting from the basic scientists who develop these vaccines, to the clinical scientists who test them in clinical trials, to the authorities who look at all the data and decide on the safety and effectiveness, like the FDA in the US, like also the WHO as well, and so on. So nothing really comes and licensed to the people till it passes from all of those processes. And research, by the way, on this is, which is the standard, at least in the Western world, has to be published also for the public, for everyone to see, and has to be peer reviewed as well by the scientific community. It's a very, very tough process. I mean, just publishing a study is really, really very competitive to begin with. So it doesn't have, so nothing really reaches us. The moment we have an injection here, it's just the end of a very long process to go through all of these steps. So whom should I trust? Well, the agencies that eventually gives us the green light. For me, anything FDA approved is definitely something I would actually trust. This is really the source, because they would have gone through everything and all data to license this product at the end. WHO in the same way, multiple rounds. You cannot imagine how many rounds it goes of discussions to be able to reach actually the licensure stage. So it's very clear. It's a very, very technical decision, and there are regulatory agencies that are in charge of doing exactly that in a very, very rigorous way. And really, these agencies are apolitical. This is another thing very important. Really, of course, many people, oh, could they be politically affected? I can tell you they are really apolitical, and they go to great lengths to ensure they're also independent. These are independent bodies. I mean, we have seen actually examples in the US where, the president wanted to impose his beliefs, which were not science founded, on the FDA. Of course, he has no power over the FDA. The FDA will decide based on the data that they have. The WHO is in the same way. They will decide based on the data. These are the source for knowledge about which vaccine are safe or not. And this is where we should put our trust in.
Thank you so much. I just, if I may add also something that, at least this is my own perspective, you may correct me, that these institutions, they don't get the reputation just from nothing. It's built up reputation throughout years and hard work, etc. And I don't think they themselves claim that there is infallibility or something, that they don't make mistakes, but there is a self-correcting mechanism. You say that after even the vaccines are distributed, there are studies. And if there is a mistake in the recommendation that they took before, they change that. So it's not,
Absolutely.
yeah.
Yes, absolutely.
Okay.
I mean,
Yes, please.
I know. I just want to say, for example, in the clinical trials, usually they include between, like for COVID-19, they were more larger. They included between 30, usually, to 45,000 people. Now, if there is a side effect that's extremely rare, it happens to, let's say, 1 in a million people, the trial may not be able to see it because there are only 45,000 people. Where we see it in the post licensure stage, because we do these real world vaccine effectiveness and safety studies. And we saw, for example, one very rare side effect, which is blood clotting. The moment this was actually start to be seen, immediately the FDA, of course, would intervene. For example, Johnson & Johnson vaccine, for some time it was blocked. AstraZeneca was also blocked. They had to look at all the data again, reassess the situation, and then move forward with the vaccine. So these agencies, they are always in the watch for whatever will happen before and after licensing the vaccine.
Thank you so much. Dr. Khalid, more or less the same question, but considering the situation here in Qatar, you must be aware about the social media accounts of self-described physicians and scientists. We are inclined to believe that they are physicians or that they are scientists. How they dress and their photos on their account looks like they are scientists, and they keep giving information themselves. I remember sometimes you would hear that from some of these accounts that nowadays the deaths of children coming from COVID-19, the intensive care units are full of children who died because of the COVID-19 vaccines in this or in that country. But then there is actually nothing. If I am living in a country like Qatar, where should I go and take my information from?
Yeah, thank you, Dr. Mohammed. This is a very good question. Actually, as Dr. Amah was describing, that vaccine hesitancy have been there for a very long time. Even there is data for 1773. At that time, also there was vaccine hesitancy. During the smallpox eradication, there was a lot even of images that because there was inclusion by cow vaccine, that cows are getting out from people's bodies, and there was a lot of misconception. Vaccinology is a huge science. It's a science that only experts can speak about. And you will be amazed how many healthcare professionals they don't have much knowledge about vaccinology. And actually, this is what creates the problem. We have a lot of healthcare professionals that they are coming out and are speaking about things without evidence, without data backing that up. And actually, it's part of the vaccine hesitancy. Vaccine hesitancy can be for a religious reason, can be for a medical reason, can be for ethical reason, and also can be for legal issues. And as the Dr. Lays and Dr. Amah have stated before, it was there for a very long time. Here in Qatar, of course, the most trusted agency, it will be Ministry of Public Health. So whatever Ministry of Public Health is issuing, this should be trusted by people living inside the country. And as Dr. Lays was mentioned, this have been studied very rigorously between the different research committee that we have here, with the data that we have, the surveillance program that we have, and also with the expertise with other countries in the JCC and plus the WHO. All these recommendations usually will fall down to the ministry, and ministry after that will take an action for the recommendation needed for the better health in the country. Nobody believes if we are putting prioritization for healthcare workers to be first to be vaccinated, that we want to get rid of healthcare workers. This is nonsense. And healthcare workers we are in a pandemic, and this is they are very precious to us. So putting them first to get vaccinated, this means that we really care about them. We really believe in the vaccine. We really believe that this vaccine will change. We change the dynamics of this pandemic. Dr. Mohammed, we are in a war between infection and injection, and we want the injection to win. Because this is the only way. We see here in Qatar right now, we are in the fourth stage, and everything is opened right now. But we see the number of cases still in control level. And why that happened? Is it because we have different? No, we still have the Delta variant right now in the country. We have different other variants in the country, but still we see the number of cases are in control manner. I will not see unacceptable, but I see in control manner. And this because we have a good coverage of vaccine inside the country. And because of this good coverage, we have some sort of herd immunity happened. And we spoke about herd immunity. So you cannot vaccinate everybody in the community because you have some category in the community that you cannot vaccinate them for different reasons. They have an allergy for the vaccine. They have different conditions that they cannot receive the vaccine. So the only way to protect these vulnerable few people, to vaccinate all people around them. And this is the concept of herd immunity. So I think trusted. We have right now a website COVID website in the Ministry of Public Health, where you find many information related to the disease, related to the contact tracing, related to vaccination. Qatar is issuing in daily basis the statistic, how many people have been detected, how many people have been died from the COVID disease, how many people have been vaccinated. We reach 4 million doses of vaccine have been administered, nearly 4 million. And this is a huge number, of course, first dose and second dose. So I think trust in your Ministry of Public Health and our Ministry of Public Health. Also, WHO have a very credible websites that we can assess. CDC, we are seeing also as a website, US, Atlanta, it's also a trusted website. But usually even us, and even the Ministry of Public Health in Qatar are getting this information from these credible sources. So I hope that injection will win in the end of this war. And this is what I have.
Thank you, Dr. Khaled. Maha, where do people get this their information from? Those who are for or against, where do they go, you think?
I think it's mostly the internet. So there's this theory that I've read about, and I'm sure a lot of people know about, that anti-vaxxers have louder voices than pro-vaxxers. So they'll be the first to tell you and list the reasons of why you shouldn't be vaccinated and all the side effects that occur. But people who are pro-vaccination usually tend to be quiet about it. They just go about their own business and get vaccinated without sharing the information. So it's very important, especially with the age of social media, that you understand the reasons of why you want to vaccinate, why you want to get vaccinated, and who you're protecting, and what the impact of getting vaccinated is, and to have a voice and to share these reasons so that these voices outweigh those of the anti-vaxxers movement. With Qatar, this is especially important, as Qatar, I think, has the highest internet penetration rate in the world. So a lot of our information we get from social media and from the internet. So I think really there's been a lot of influence and a lot of stress that we should get all of our information from the Ministry of Public Health, and the Ministry of Public Health has a very strong communications team who's managed this throughout. So yes, it's the internet, it's a blessing and a curse.
Yes, it seems social media is a key word in this situation, and things go viral when they look weird and strange. But there is something, I don't know if you agree with me about what I noticed. I'm not very active in social media, unfortunately, or maybe fortunately. But there is the main tone is anti-establishment tone. So it's anti-government, it's anti-scientific institutions, anti-FDA, etc. But they make use of these establishments. So I remember there was something about someone called Michael Yidun, maybe, and he was presented as the chief researcher in Pfizer. And he is doing that. Of course, you use chief researcher in Pfizer to sell. So even if there is anti-establishment tone, it seems they are still working with these establishments to make their words trustworthy. But this is a good point to move to Dr. Laith about this point in particular. By the way, whenever I ask a question and you want to comment on each other or to add something, please feel free. So we are not creating walls between the specializations. Feel free to those in science to speak about ethics and vice versa. If it worked, because we are all together, we can correct each other. The case of Michael Yidun, it was mentioned that he said that this vaccine, he wrote a letter to Pfizer, I think, or something, and say you have to stop clinical trials on vaccines because this will cause women infertility. Of course, women infertility was one of the arguments used also for polio, for other vaccines, but this was raised in particular for the COVID-19. This is an incident to speak about what is this, the case, what's going on. Do COVID-19 vaccines, any Pfizer or any other Do we have any indication that they can cause women infertility? And more specifically, as some people who got involved in the religious discourse, Muslim women in particular, these are meant for sterilizing Muslim women. What is available now from scientific data about such discussions? Because it's about the safety, of course, of the vaccine.
Mm-hmm. Yeah, so really, it's a very straightforward. There is no evidence whatsoever. But that's actually very interesting. This infertility issue seems to be coming up in a lot of these. I mean, it came up with polio vaccines, came up actually with many others as well, medical interventions, especially in the Islamic world. I mean, even with treatments, some people suspected that there is something, in relation to this. So really, there is no evidence whatsoever, nothing about anything. But I can tell you, at least for pregnant women, we know the vaccine is working very well. In fact, we have done the study in Qatar, and it's highly effective among pregnant women. It's protecting them because they are even at higher risk of COVID-19 complications. So again, really, for me, I feel it's a bit frustrating, to be honest with you, that we have to even counter such things and such claims which are baseless, when we do have the data already. I mean, we do have the data from all the clinical trials. We have tons and tons of studies, thousands published, that's actually available to everyone to go and look for. And they can see if there is any effect for something like this. And there isn't. So then why do we really have to put ourselves always in this position of being, defensive, even though we should be in the offensive, because we are the ones who generated the science, and the science says very clearly there is no problem.
Dr. Khaled, you want to comment on this point?
Yeah, actually, as a human, the most precious thing for us to regenerate is to have next generation. And I think this is why whenever there is a danger, it's about danger that will not exist anymore. And this is why related to any new intervention in medicine, and people will feel unsecured and think about infertility. Actually, the only thing that I can say that, as Professor Lace was mentioning, that look at the data, and right now we are using the vaccine for more than 1 year. The number of births in Qatar didn't change. Actually, it's grow. So this is how can we show people data? Look at the data. Just look at the data. How many? If we see that there is a decline in number of births, then there is something wrong, because we already vaccinated a huge number of pregnant women. And they got their children, and even alhamdulillah without normal defect issues as normal in normal years. Vaccine hesitancy and people speaking about it, as Dr. Maha was saying, that I think their influence in the social media is more bigger than people that pro-vaccines. And in 2019, usually WHO every now and then will address what are the public health issues that we are facing in the entire world. And actually, vaccine hesitancy was one of the top 10 public health threats for the whole humanity. So antimicrobial resistant, non-communicable diseases, Ebola, all these have been mentioned as public health threat. And vaccine hesitancy was put in one of them. Because when you prevent people from getting something that to secure their life, make better for their lifestyle, this means that this is a real public health threat that need to be tackled. So it's a real big issue, and people need to address it very well. And I think I'm thanking this panel to be here to address, because this is a very important, especially right now in the time of pandemic. The clock is ticking, and we all need to actively participate in this vaccination campaign to get back to normal. Another thing that if we look to the Muslim world, because we spoke about Muslim world, it's very unfortunate to see that we have only 2 countries in Muslim world that they are pre-qualified by WHO for production of the vaccine. So yes, we are buying vaccine, we are utilizing vaccine, we are buying them from the mother companies and all of that. But I think at the Muslim world, we have to invest more in the production of the vaccine. And this is licensing, manufacturing, clinical trials, All these things need to be established. We have only Indonesia, and recently we have Iran. They came to the picture to be as a Muslim country that they have trials for COVID vaccination. In Indonesia, they have something called Pharma. It's a very large company for production of the vaccine, and they are producing most of the vaccine that they are using for their child immunization. I think at the Muslim world, and especially in GCC countries where they have the amount of resources, and especially the economic resources, I think we have to spend more on the production of the vaccine. We have to produce our own vaccine and not to depend on others. We are fortunate right now that we managed to get a high number of vaccines in the country to purchase. But right now there is a big dilemma and big ethical problem actually in the globe, where 43% of the production of vaccine is have been utilized by only 10 countries, which are the wealthiest 10 countries. And we have the poor country until now, they don't receive any sufficient amount of vaccine, even to vaccinate the healthcare worker, which is a big dilemma. And actually this will lead to a pandemic to extend. And as I said, we are in a war between infection and injection. And as long as these countries, it's not about you have to vaccinate your country only. You have to look also to the other countries, especially the poor countries, because if you don't give them enough vaccine and they will not control the infection in their country, we are just giving a time for the COVID infection to create a new variants that maybe we'll face a variant that it will be resisting to the vaccine that we have. Until now, alhamdulillah, the vaccine is working against all variants, and we have an evidence of that, but we need to control the pandemic in all countries. And there should be a huge investment from the wealthiest country to the poor country to donate more vaccine, to make sure that they are controlling the pandemic in their countries, to make sure that we are controlling this COVID infection. COVID infection will be with us for a very long time. And it's evident that COVID virus right now is becoming to be one of our respiratory virus in our atmosphere. So it will be there. But the only thing that we are hoping that it will mutate, and hope that the mutation will be very small, not a big mutation to create a whole new strain that it will be the vaccine will not be effective against. That's why from the start I said it's a war, and we have to accelerate in this war with our injection. Thank you.
Thank you. I just want to comment on the issue of the infertility as one of the possible side effects or something. This was mentioned in the Islamic religious discourse on this. By the end of the 20th century and the beginning of the 21st century, a number of muftis, religious scholars in Nigeria, in Kano specifically, the city, they issued a fatwa prohibiting polio vaccination for the children because of they contain impure materials, ritually impure materials, but more importantly, because they cause infertility for the girls that they will be vaccinated. Based on this, Kano stopped the polio vaccination campaign. About 300 children were paralyzed because of polio. And information came to religious scholars here in the Arab world and to the International Islamic Fiqh Academy based in Jeddah. They had a special event to discuss this issue, and they issued a declaration harshly condemning what happened in Nigeria. And they said that not only the parents of these children bear the responsibility, but also the religious scholars who issued these fatwas. And speaking about side effects or basing the religious ruling on scientific information cannot be done by the religious scholar himself, but should be based on consulting the scientists, specialists in this regard, to know that there is a bad side effect, and that's why we say that it is prohibited. They said, we ourselves contacted the Muslim physicians in the World Health Organization. They confirmed that there is no such a thing. And it seems some of them even attended the discussions. There was usually Dr. Haytham Al-Khayyat from Syria. He was a frequent participant in the discussions of these juristic councils. It seems he was one of the informants at this time. And they took a very strict position against this. So it's very strange that it comes back again with the COVID-19 vaccines, and the same question is done, but in this time, given a scientific little bit cover through Michael Yidun. What I have read also, if you can confirm this or say it's wrong, that what was published is that Michael Yidun, he was for sure not the chief researcher in Pfizer, and he was not even a specialist in vaccines, or he was something in allergy and respiratory system or something like this. So and at the end, I think it's like the religious discourse. It's not only about the name. It's not only about one person who speaks, but it's about the scientific community at the end, and what is the voice of the scientific community. And I may just add a few things about this differentiating between myth and fact, credible, non-credible information. Also in the religious discourse, we have this issue. And we receive so many questions about this. What should I do when I have different opinions and all this stuff? And I say, based on what I have read and my studies in the opinions of different religious scholars on that, the main aim of consulting a religious scholar is not to get his opinion, but to know what God wants me to do. So as a Muslim or as a religious person in general, so there is God, and I want to live in accordance with the will of God. The one who created me gave orders, prohibitions. I do this, I don't do that. If I can know this myself, by myself, then you don't need anyone. You just know it and you do act accordingly. The problem is that many times we don't have the knowledge that will enable us to know that. So when I read the Quran or I read the prophetic traditions, for instance, when it comes to vaccines, it's very difficult because there is so many layers that you have to go through to come to a conclusion. So you need an expert to tell you about that. The first thing is that there is an important development in the Islamic religious discourse, is that we don't have not only individual religious scholars, but we have also institutions. The religious discourse has been institutionalized. And the more brains you have, the less the margin of error. When you have more people, the possibility to make a mistake gets less. So we have the International Islamic Fiqh Academy in Jeddah, the Islamic Fiqh Academy in Mecca, the Islamic Organization for Medical Sciences in Kuwait. We have Al-Azhar in Egypt. We have the fatwa, national fatwa institutions in the countries, etc. Also, one of the important factors that should be considered when we speak about an issue like vaccines is that not only religious scholars are involved in the fatwa, but also scientists. Because as we mentioned, many of the aspects of the final judgment are depending on the scientific information that I, as a religious scholar, receive. So if I get misconceptions, my conclusion will not be the right one. These institutions, especially the transnational institutions like the one in Kuwait, the one in Jeddah, and the one in Mecca, they have on a regular basis and constant basis consultations with scientists in different fields and different specializations. This also gives much more. The last thing that the individual should look into, besides looking about who is introducing the fatwa and who is he consulting with, is the content of the fatwa. When I read this content as a Muslim, as an individual Muslim, should I feel in my heart that this is what God asks me to do or not? Once you get the conviction that it's yes, then you have to follow. But if you don't have the conviction, you have the full freedom to ask another one, a third one, and a fourth one. You yourself do your own research till you come to a conclusion. So this is more or less also about the myths and facts in our discourse, also from a religious perspective. Any comments before we move to other rounds?
If you allow me, Dr. Mohammed,
Yes,
I just want to comment about the Nigeria fatwa. You are absolutely right, and I just want to explain the impact of kind of these fatwas. And you already spoke about the children that they got paralyzed, and I think sometimes in infectious disease we forget how harmful these diseases, and we forget how the rigidity that happened with tetanus and how children were suffering from neonatal tetanus and how many people died from it. How the complication that we have from polio and the paralysis and people with living with disability all their lives. I think because of vaccination, we didn't see these diseases anymore. So people start to forget. And fatwa like this in Nigeria led to that Nigeria is behind eradication of polio. Usually in infectious disease in public health terminology, we have three terminology that we use with infectious disease. We have disease control, disease elimination, and disease eradication. And usually when we use term disease control, this means that minimizing the number of cases until a control percentage that we say, for example, if we have 4 cases of TB in 100,000 in Qatar, so this is a TB control program. So the TB is controlled in Qatar. And then we have disease elimination. So this is elimination of reducing the number of the cases until we reach 0 and there is no more cases. And lastly, the eradication. Eradication, this means that the absence of the causative agent, that virus or bacteria in the environment, is not only in human, even in the environment. You don't see it anymore. And usually this is our aim with vaccination. So usually in infectious disease, we want to first to control it, eliminate it, and lastly eradicate it. And we, as a human, we succeeded in smallpox. And we are very, very close in polio. But what's happening on polio? Because of kind of this fatwa, right now we had only 3 countries in the whole world that still have an active case of polio. This was Nigeria, Pakistan, and Afghanistan. And alhamdulillah that Nigeria lastly, as you said, they had people coming up and speak about it and like that. And last August 2020, Africa was declared that eradicated polio. So right now Africa is free of polio and all the effort have been succeeded. But until now, we have 2 countries, Afghanistan and Pakistan, they are forbidding the whole humanity to get rid of polio as such a nasty disease that people live with disability. And this is because of what? Because of this kind of fatwa, because of this kind of people that they are issuing this kind of fatwa and letting more children to be affected. Until now in Pakistan, Afghanistan, if you are coming with a polio campaign, you may be shot. The parents may shoot you with a gun because they are thinking that you want to infertile their children, you want to kill their children, and instead that you want to prevent them from getting the disease. So it's very important that people know exactly when to talk about anything related to Islam and fatwa. This is very, very important, and we saw the impact of this fatwa with the polio in particular as a disease. Until now, we cannot eradicate polio because just there is active cases just in 2 countries, and these 2 countries still depend on this kind of
yes, you are right. By the way, the fatwa harshly condemned attacking people who participate in these vaccination campaigns, etc. But by the way, also to be balanced in describing the situation, there have been studies, and I invited the one who wrote about this, one of the professors in England, I think. Unfortunately, he couldn't join the summer school and he couldn't be with us here because he just had a baby. So there were some studies about especially Afghanistan and Pakistan, because these are the countries where the most anti-vaccination voice, I'm speaking here about the religious discourse, come from. They said that there is a correlation between the frequency of drone attacks on these countries and the religious and the attitude of people to accept or to reject vaccination. It seems that people think that it's not possible to give me with the right hand vaccination and with the left hand drones destroying everything. I cannot believe that the same person would do both. And there were also, the professor spoke about the 2012 scandal. I couldn't verify this, but if it happened, it will be really disastrous. CIA initiated a false vaccination campaign in order to get the DNA of the family of bin Laden or something like this. Of course, this will have impact. So it's not just the religious scholars who are speaking about this or the general people, but there is a political misuse of the situation, and this also makes things worse than they are actually. Just to mention also the full picture about these issues. We received, Dr. Laith or Maha, you want to comment on anything of this so far?
I just want to confirm, yeah, no, it's actually, it has been also already recognized by the US government. They did a false vaccination campaign to actually enter into bin Laden's home and take DNA of the children, and this is how they actually managed to confirm the identity of their father. Yeah, and it was very, very embarrassing. I mean, this is totally unacceptable, you know, to use vaccination for something like this, regardless of whatever they want to do. I mean, we cannot mix really vaccination with politics. This is really a public health right that should be given to everyone. Now, Obama, by the way, declared an executive order banning any such use by any covert operations related to vaccination. I mean, the U.S. government was very embarrassed, by the way, about that, and
it is something to be condemned.
Yeah. Sorry? Yeah.
I say it's something to be condemned, to be harshly condemned.
Oh, absolutely. Absolutely, yeah.
There is, by the way, in bioethics, we have a special section about bioethics in times of war and in war zones, and how physicians should remain neutral because they are not part of the war. They are there to help the victims, not to misuse the civilians and stuff like this. There is a whole subfield in bioethics about this. One of the issues that Maha just spoke about was about using impure materials. You want to add something more than what you mentioned about this issue? You said that some people were quite hesitant or anti-vaccination because they thought that the vaccines contain religiously prohibited material. Is this true?
Yes, so there was both about fetal cell lines. I think that was the issue with the Sinopharm vaccine. Correct me if I'm wrong.
Okay.
And then the pork gelatin in the Pfizer and Moderna. I'm not sure what happened with the fetal cell lines, to be honest. I'm not sure if there were any religious authorities that spoke up about that. Maybe Dr. Ghali, you can pick up there. I'm not sure.
Yes. Just to explain the discussion before I give the word to Dr. Laith and Dr. Khaled, there are certain materials and ingredients that Muslims are not allowed to consume in other religious traditions. For instance, Judaism and Islam agree on the prohibition of consuming pork, for instance. So there are certain elements that shouldn't be consumed by a Muslim because they are considered ritually impure and religiously prohibited, like ingredients from pork, especially the meat of the pork, etc. And if this is included in medicine, or in this case, vaccine, there is a discussion about this. I explained this in details in the summer school. At the end, I will say something about what the fatwas mentioned about this, but let's just make sure what our scientists today say about it. Does any of the vaccines contain material coming from pork, porcine material? Dr. Laith?
To be honest with you, I do not really follow exactly the ingredients, other than the active ingredient, which is of interest, of course. Now, definitely there are other ingredients that are used for different purposes, to stabilize the active ingredient and so on. Now, whether something from pork or no, to be honest with you, it's beyond what I know. Yeah.
What I read myself is that there is sometimes they use porcine gelatin as a stabilizer. It's not one of the core ingredients, but it's stabilizers used for storage purposes. But the WHO mentioned that the vaccines, at this time it was Pfizer, I think, and Moderna, do not include any animal material.
Yes, Dr.
Okay.
Mohammed.
Dr. Khalid, you want to comment on this?
Right. Yeah, so you're absolutely right. During my review I'm talking about just COVID vaccination to be very clear. So even in
you are talking about, can you raise your voice a little bit? You're talking about which vaccine?
COVID vaccine. We are talking about COVID
vaccine. Oh, yes.
RNA in specific. So there was a statement from Pfizer and also from Moderna that the vaccine doesn't contain any pork material or doesn't contain any gelatin inside them. For other vaccine, there was before some part of it that it comes from pork, and I think it was reduced to something that will not affect, because I think that there was some scholars spoke about that, and they said that the amount that it doesn't make that it is something that it will be consumed as a food or something like that. But recently, many of the manufacturers of the vaccine, they used to change the pork gelatin with the bovinian gelatin to make it more acceptable. But even if you do it with the bovinian, for Indos it will be a problem because they don't want anything related to cow. So I don't want to go in these because this will confuse the audience, and everybody each time will not be satisfied. If we are putting a bovinian gelatin, the Hindus will not be happy, and if we do it pork, the Jewish and Muslim will not be happy. The idea of halal vaccine have been addressed by Indonesia before, and Indonesia right now they are saying that they want to produce halal vaccine. Although I have my reservation and this terminology halal vaccine, because I think in vaccine we should look at benefit outweighing the risk. What is the risk and what is the benefit, and what is the vaccine actually is doing? And the amount that putting in this vaccine is very little that we shouldn't talk about. By the way, gelatin is not only in the vaccine. It goes in all candies that our children is eating every day. Anybody spoke about candies? Anybody spoke about other material that it contains? Nobody spoke about it. But in vaccine, they will speak about gelatin in vaccine. Believe me, there is a multiple manufacturers that gelatin are containing. But when it comes to vaccine, everybody spoke about it. When it comes to other materials, nobody speak about it. That's why I don't want to go inside these details, because I don't think that there is something that needs to be discussed about. I think we know that vaccine are effective. We know that vaccine are important. We know that vaccine change the map of diseases. Our fathers and grandfathers, they used to suffer from infectious disease. Many of them, we have so many cases of neonatal tetanus. We have so many cases of other disease that people used to die from. So infectious disease was a big burden before 20th century. When it comes to 20th century, one of the biggest achievement with automobility, sanitation, and water supply, and like that, vaccination was one of the big achievement of 20th century, and Georgia totally changed the map of diseases from infectious disease to non-communicable disease. Now we are living in a modern era where people dying from diabetes, cardiovascular diseases, hypertension, all of these diseases that we don't hear right now many people die from infectious disease. The mortality rate of infectious disease in Qatar is about 9 to 10%, compared to 70% dying from non-communicable disease. You can see that the big difference, even where the people are dying from what. So definitely vaccine have played a great role to change this map of disease from infectious disease to non-infectious disease in our modern era. So this is what we have to concentrate on.
Dr.
Thank you.
Ali,
Yes.
I agree. I also saw there was an article, a news article online. It was about the Catholic standpoint on the fetal cell lines. They were, because obviously pork gelatin is not an issue there. It's more the fetal cell lines and their extraction and how they link to abortion, or whether it's linked to abortion in a way. So that was their issue. And I think the consensus was that if they, again, like Dr. Khalid and Dr. Ali said, that if the benefits outweigh the risks, then it should be taken, it should be considered a treatment or like a prescription or a medicine rather than something that you consume, rather than, you're not consuming it in food, you're taking it for the betterment of your health and the betterment of the health of others. So there was also that argument.
Just to summarize the discussions in the fatwa literature about the issue of prohibited ingredients included, with the exception of some voices, again, in Afghanistan, Pakistan, some also in India, who declared that Sinopharm in particular was prohibited because it included just material. Fatwa was issued by the institutions I mentioned in the whole Middle East. They said that some of them said some vaccines do not include such material, period, because this is what these companies already indicated, specifically BioNTech Pfizer vaccine and Moderna vaccine. And they were mentioned in some fatwas in particular that this is an irrelevant point. To mention this an argument. But then they moved forward. Imagine that this was the case, that they include that. We have already classical discussions in the Islamic literature about including such material for treatment, including even wine for treatment, and how far it can be possible, with the exception of wine. When we speak about prohibited materials, they said for the case of COVID-19 vaccines, we have what we call in Islam excused or pardoned impurities, النجاسة المعفو عنها in Arabic. Not every single form of impurity is automatically and strictly prohibited. Some forms of impurities can be pardoned, excused, declared as permitted to use on some grounds. One of them is that they are quite little in volume. Yasira, najasa yasira, as we call it. And they said, even if there is some impure material in the dose of the vaccine that you get, it's microscopic. It's not something that anyone can see. So it's for sure under this ground, it will be pardoned. This is one. The second, if we speak about the gelatin, the porcine gelatin, which is used as a stabilizer, this is used for storage purposes, but this is not the vaccine itself. So this is what we call impurity by proximity, النجاسة بالمجاورة, because it's next to, and this can also be pardoned because it's just by proximity. It can be excused because the impurity is not existing in the current form of the material. For instance, we have wine. This wine got transformed into vinegar. We can consume the vinegar, although it was originally wine. Why? Because now we have a different thing that we call it also differently, which is vinegar. So the transformation, al-istihala. And there is another ground which is very clear in our case, what they call umum al-balwa. Umum al-balwa, you have a condition which is public in nature, widespread. It's not for individual or certain individuals. So, for instance, classical religious scholars spoke about the impurities when you had the cattle and the cows and the animals wander through the streets of a village, for instance, and their material, when they do this on the street, get mixed with the mud, and then the mud will be impure because it included these animal materials. But in the past, people didn't even have shoes or whatever. They just walk throughout the street. Their clothes, they get in touch with this mud, etc. If they say, out of precaution, we say that anyone who gets in touch with the mud through barefoot or through clothes, etc., cannot pray, is not pure, etc., it will be too difficult. So we excuse that. Why? Because there is umum al-balwa. We have here a pandemic, so something which is hitting every society, every country, every continent. It's everywhere throughout the world. So there are so many grounds to declare that even if it contains what we call impure material or religiously prohibited material, we can still accept and declare that using such a vaccine is possible. I just want to add to this as a footnote. I do agree with that, but I want to say that if you are unsatisfied with this situation, that too much pork is used for treating medicine, for instance, that we are using cell lines from aborted fetuses, etc., Muslims should develop more science. Because if I am not a Muslim and I am not a Jew, a committed Muslim or a committed Jew, and I think these things are prohibited, why would I ever think that this is a problem? It's just something available and I make use of it. Maybe there are some scientific issues that made this mandatory, but if this is not the case, I would do that because of my background. If I'm a Jew, I would say, oh, why would we do that? Let's try something else. This will happen automatically. So let's improve scientific infrastructure in the Muslim countries, produce original scientific discoveries and improvements and advancements, and then you will not see these problems. So this is just a footnote about this issue. If you allow me to go through the questions quickly, some of the questioners already mentioned to whom, but even the general questions, we can do it. And if possible, we can give quick answers for quick questions. A question, as immediate side effects are perhaps more detectable. So one question is about long-term side effects. Are we sure when it comes to the safety about long-term effects?
Okay,
so would you like to answer
yeah,
this one?
Sure. Yeah. So of course, nobody knows the future. So nobody can claim that we can absolutely say there is absolutely no side effect to appear in the future. But we know the past, and we know the past well. So we have been now developing vaccines for 2 centuries. Thousands of vaccines have been developed, not only for humans and for animals. And we know something very well about this vaccine development. If there are side effects, they would appear in the first 2 months after vaccination. Why in the first 2 months? Because this is the time in which the immune system activates and it goes through its full cycle of activation before it reaches the plateau. So if there is anything really the vaccine will cause, is going to cause it during these two months. This is why the likelihood of long-term, very rare thing happening, it's really very, very unlikely, even though, of course, we cannot exclude it, absolutely. But we have lots of experience with previous vaccines. Everything confirms this. Just like, for example, if let's say now go to a restaurant and eat something, and if, let's say 2 months later, I will get food poisoning, can I claim that food poisoning happened because of the food I ate in a restaurant 2 months ago? Of course not, because food poisoning happening in a very short cycle, which is just within a couple of days after I eat in a restaurant. If I don't get food poisoning at that time, this means it's very unlikely it's going to happen actually again. So this is really what we know, scientifically. Now, also, I want really to put things in context in this regard, and I like a lot Dr. Khalid have put it very nicely. the war between infection and injection. What is really left in all of this is a very simple reality in infectious disease epidemiology. We only have two choices right now, either to get vaccinated or to get infected. If someone thinks that they can avoid both, this is really a waste of their time, and this is really just simply not reality. Why? Because herd immunity for this virus right now is at about 90%. What does this mean? Sooner or later, the virus will continue to spread till we actually control it through herd immunity. And we cannot get herd immunity till either people get infected or vaccinated. The likelihood of anyone not to get vaccinated and not to get infected is very, very small, and it's less than 10%. We really don't have a choice right now. I mean, we are putting, like many people put the stuff, the question as, is it really, do I want to vaccinate or not? This actually choice not existent anyway to begin with. The choice right now is, do I want to get infected first or do I want to get vaccinated first? Thank you.
Thank you so much. This question may be for you, Maha. It says the questioner says the majority of villagers in my country believe when people who died after vaccines more than believing in 1 million people who are survived because of vaccines. Someone replies the same thing happening in Malaysia. Some Malaysians even established adverse event following immunization. It's a group, it seems, on Facebook or something, with 70,000 subscribers. They posted chronological events that begins with first dose of vaccination and implied saying that people died because of the vaccine. It seems bad news attract people much more than good news.
Yes, that's exactly the answer. So bad news spreads like wildfire. So you're more likely to tell someone of the death of someone that you know rather than, oh, someone I know got married. It's just the nature of us as human beings. You know, we like to spread bad news, and bad news gets a lot of traction. The similar sort of higher impact example of this is like in 1998, when a scientist faked some data on the link and caused a fake link or fake causation link between and the MMR vaccine and autism. And so this was quickly retracted, but by the time it was retracted, it had already spread, and everybody, until now, we're hearing of people and parents who refuse to vaccinate their kids because of this. So it spreads like wildfire. People really like to believe bad news, especially when it comes to their own health. So it's really unfortunate, but that's the role, I think, of powerful communication, especially social media. That can be the role of the WHO has done a very great job during this pandemic and trying to spread facts that are easily digestible to the public, to try to sort of debunk all of these myths that are going around.
For Dr. Laith, there is one who seems that offering a third way, you said infection or vaccination. What is your opinion if people opt for natural remedies instead of vaccination, as they claim that natural remedies work for them better than taking jabs? By the way, this is what Mahatma Gandhi mentioned in his article, that for the smallpox, that we better improve our immunity systems in the natural way. And I'm sure you have seen some stuff about this on TV everywhere the last period. The question is now, to make it a little bit more seriously, is there a third way that we just improve our immunity system so that we'll be stronger for the virus?
No, it's just very simple. There is no evidence for anything like this. And by the way, the problem with our immune system when somebody gets infected is not that the immune system is weak. I mean, this virus really can kill even very healthy people. The real problem with it is that the immune system is unprepared with the massive onslaught of such very nasty infection. Lots of people, by the way, they did not die because their immune system collapsed. It's exactly the opposite. they actually had so hyperactivated immune system that they died because of the immune reaction, because of how strong is the immune response, not because of its actual weakness. So this is really, it's not really a question even about really strength of immunity. But your question brings very interesting, in fact, thought, let's say. You may have heard recently there was a study which tried to look where the misinformation about vaccines are coming from. And in fact, most of it turned out to come, and I think, Maha, please correct me, you know better about this, apparently from 12 people globally who are so smart in spreading misinformation about vaccines. And as it turned out, some of them, they do it for financial reasons. One of them turned out to have a net worth of $100 million. And what this person is doing is actually selling alternative medicine to people. So this person, really what he does is to spread misinformation about true medical interventions that save people in order to actually sell people alternative medicine to get rich. I mean, so this is really unfortunate.
Yeah. Yeah. Thank you. Dr. Khaled, we received more than one question, including this one, about the distribution of the vaccine, and that some individuals, some sectors of the society, and some countries are more privileged than others. He says, they say, what's your take on this issue of equality, inequality, equity, and privileging of some people or some countries?
Yeah. Actually, I don't know how to put it in a nice way, but this pandemic has shown us how, as a human, how we behave. And everybody to secure his family. Right now, each one of us, very thing that you think about is your family and how to secure them. And this is actually what happened with countries also. Everybody wants to secure his nations and territory and people who live on, and then after that for his economic prosperity. Wealthy country, they have the money and they start to negotiate with the company that producing the vaccine. And they purchase, as I said, like 43% of the production of the vaccine have been went only for 10 countries in the world. You have countries like India, they didn't reach the 3% from the whole population to be vaccinated. And you have countries like US and, for example, UK in particular, they reach like 60% of population have been or less than 60% that they have been vaccinated. You have countries right now that are looking for the third booster dose, and they have countries that they have none doses at all. So it's a very strange world. So that's why I think the COVAX initiative that have been adopted by WHO, I think it needs to be supported by all countries. COVAX initiatives usually will support that wealthy country will donate for poor countries. And I think this should be the way forward. Unfortunately, nobody can do anything on this unless we all together come and address this issue. There is a statement by WHO, and the statement is very clear. Nobody's safe until everybody's safe. We should all know that very well. Nobody's safe in this world until everybody's safe. So if you are living in a country that already you reach your herd immunity and things are better, you need to think about others. So as I said before, we'll not give a chance for this virus to mutate and create a totally new variant that it can attack again. Better that we leave it that it will be one of our respiratory virus, and it will take its time because it can mutate with the long term, of course, and this is very obvious with all viruses. We were prepared. All our plans, emergency plan for pandemic influenza, we never thought about coronavirus. We have built so many policies for pandemic influenza and what we do with pandemic influenza, and if the influenza will mutate, the influenza A is all they have to shift and drift. This means that small, tiny mutation or big mutation and will happen. And we done so many surveillance programs for influenza, and we were looking for influenza virus everywhere, taking samples from the community, taking samples from the hospital, making sure that we have a respiratory panel for the country. We know all the viruses circulating in the atmosphere of each country. We send these samples to WHO, so WHO will divide the world to a northern hemisphere, southern hemisphere, what kind of virus circulating in these two hemispheres, and what is the next influenza vaccine, what should it contain, that influenza vaccine, what are the prominent subtypes of influenza A virus that need to be in that vaccine, and this is how we work about it. So now we hit with the corona, something that we had some coronaviruses that circulating in the atmosphere, and we get used to get common colds and different kind of upper respiratory diseases from it, but we never thought that it will change like that. So and suddenly we have the Middle East coronavirus, which is MERS, and it was here in the Middle East, in Saudi Arabia, Emirates, and here in Qatar. But the good thing with the MERS coronavirus that we found some causation between the virus and the dormitory camel. So there was, so if you are working with camels, so you are high likely to get this virus. But right now, even that, and we had all our precautions, the coronavirus totally changed and give us this new COVID virus. And it's very transmissible between human. It have the different strains, and last right now the Delta strain that everybody's suffering from it. Yesterday we reached nearly 2 million people in the whole world have been infected with coronavirus, with 4.2 deaths all over the world. So this is something that we need to be prepared for. So I think.
Thank you.
Yes, yeah.
Yeah. Yes, thank you. I also just want very quickly to support this point about caring about equality in the distribution, etc. That unfortunately many of the fatwas did not touch about this issue. Besides talking about the prohibited materials, ingredients, and this stuff, I would have liked to see this also as a big concern. And if the muftis cannot speak to the rest of the world, at least to the Muslim countries, there are rich Muslim countries like Qatar, like Saudi Arabia, Emirates, people here in the Gulf, and there are very poor countries. At least there should be some solidarity between these countries, between these societies, at the global level. I think one of the big lessons that we must learn from the pandemic is that it is global. So there should be a global action, not instead of learning the lesson to be together as one human family, that every society or every country will get isolated in their own niche and try to fight alone. It will not work, I would say. Another ethical issue that was raised by one of the questions, the question was directed to Dr. Laith, but I think Dr. Khalid and Maha can also comment on that, about the vaccine companies and if they should share the formulas with the world in this pandemic situation so that the countries can produce their vaccines too, about the patenting issue.
Yeah, so it is actually, if I maybe start, it's a very, very complex, by the way, question, much more simpler. Now, in principle, yes, because this will help with having greater access to the vaccine. Now, but it's really far more complex situation than people think, because there is also one issue about quality. These are not easy to produce vaccines, especially the mRNA vaccines. How much can you actually assure the quality when you outsource such production somewhere? Now, then another issue has to do, of course, with the intellectual copyrights and technology copyrights. What are the implications for those companies who invested billions of dollars, in developing these? Are we going to punish them now because they were so innovative to produce these vaccines by actually taking away their intellectual copyrights? I think these are really very, very complex questions. they cannot really be answered by just taking the formulas. They have to be really addressed through a global action at a much higher leadership level as lessons learned from this pandemic of how we can avoid even these kind of questions in the future. I don't think we should put only the weight on the companies that manufacture the vaccines. We should really put more weight on the shoulders of the political leaderships of this planet, you know, of how they can actually have a better situation next time we encounter such a pandemic.
Thank you. Any further comments?
Yeah, actually, you remember, Professor Ghali, that I spoke about the production of the vaccines and how complex it is, from licensing, manufacturing the vaccine, making sure that you have safety and quality assurance procedures, the expertise in the country that need to be there, ethics, clinical trials. It's a very complex process. So the only way, and I actually here I'm speaking about Muslim world. For me, I think the Muslim world should unite on this, and should have some sort. Right now, as I said, Indonesia have a great experience. Everybody can take from Indonesia experience and spread it to other countries. And this also will give a power, as you said before, if you don't want a vaccine with a question mark that it have anything in its content, better that you produce your own vaccine that you know everything in this content. So it's a complex process to produce these vaccines. On the other hand, I will give an example of AstraZeneca vaccine. So AstraZeneca vaccine is AstraZeneca Oxford vaccine, which it's a joint collaboration between AstraZeneca company and Oxford University. And actually, the UK government have spent billions of money in that vaccine through the university. And I have been reading a lot about it. So you will see that AstraZeneca vaccine in particular, it's a university vaccine actually, more than the company vaccine, where the University of Oxford have been spend a lot of money on it. But still, all the credibility went to the company. So yes, I agree with Professor Lace. We shouldn't blame companies because they have been there for a very long time, but still companies are companies and they look for the profit. But in the same times, we have these companies are working in countries where countries have a regulation, and these countries should control these regulation, control these companies, because in the end, if you want to exist in one country, you have to follow the regulations of that country. So it's more like a political judgment and a political decision what needs to be done with these companies. And I will give you an example. For example, for AstraZeneca, when they sold the vaccine for Africa, for South Africa, they sold it for $5.2, where they sold the vaccine for $2.2 for the European countries. And why that? Because the European countries have donated or have put some money in the trials of the vaccine. So they sold it for them in cheaper way, where South Africa is a country, the developing countries, and they need any penny, not only the dollars, but still they have it for $5. But still, it's better from the price is better from others. It's all with ethical dilemma all over the world. But still, as I said, if you want to control yourself, you have to have your online production, and this is my conclusion on that.
Thank you. There is here a comment from Dr. Mohammed Farji. I think this is Dr. Farji from Weill Cornell. He said that the companies for Moderna and Pfizer have categorically denied the inclusion of porcine content in any of the vaccines given to humans. The mention of porcine in any vaccine is fake news perpetuated by more than ignorance than anti-vaxxers. So thank you for the notes. I refer to this, I think, that some of the fatwas mentioned the Moderna and Pfizer in particular, and they said, as per the statement of these companies, they don't include animal products. Some quick questions for you, Dr. Laith. Is COVID-19 vaccines, are they safe for pregnant women?
Yeah. So short
Yes?
answer, yes.
Okay.
No issues.
Okay. Are there differences or ranking, if we may say, between the vaccines? Are there better vaccines than others?
With data now accumulating, yes. The best vaccine is Moderna. This is actually now growing studies from here and everywhere. Pfizer comes second, then AstraZeneca and Johnson & Johnson, they are pretty comparable, and so on. Yeah.
And the vaccines developed by China and Russia, are they okay?
These really, they haven't been developed in the process that we can trust the most in terms of vaccine development. So for example, really in terms of data, they are much more thin to be able to judge. This is why from the beginning, actually here in Qatar, the direction was we will invest on the vaccines that have the best data, which these tended to come from Western countries. Yeah.
And the thin data makes us worried about their safety or their efficacy or both?
It's more, I would say, efficacy rather than actually safety. So eventually these even developers, they provided enough data for the WHO to qualify the vaccines. So in terms of safety, we are actually less worried. But in terms of efficacy, we are concerned because, and in fact, there were good reasons for concern, as you saw more recently. Yeah, definitely turned out the mRNA vaccines are the best vaccines we have right now.
Okay. A question to Dr. Khaled. You spoke about war and the race between infection and injection, as well as mutations and public health risks identified by the WHO. The WHO has also identified that AMR emerges and pathogens of zoonotic origin mutate quickly in factory farms, where animals are raised for food and more than 50% of all antibiotics are used. Why is this fact not being addressed, and why is this war against the virus not being tackled at the origin by spreading awareness of the public health risks of animal farming by health professionals? Why do we continue to farm animals and risk emergence of new viruses such as this and merely depend on mass to deal with the symptoms?
I think the questioners was talking about antimicrobial resistance that have been grown. Actually, antimicrobial resistance is a growing problem, also being addressed by WHO, and it's one of the public health threats that we are facing, and it is about unjustifiable, irrational use of antibiotics. This is in human, in animal, and in agriculture. And it have been addressed, as I said, by WHO as one of the public health threats that we are facing right now. And actually, there is a quite relationship between vaccine and antimicrobial resistance. And I would give, for example, pneumococcal vaccine as an example. So usually, pneumococcal vaccine have invasive diseases and non-invasive diseases. And one of these non-invasive diseases actually is the otitis media that happen in children. So by giving them pneumococcal vaccine for children, we are preventing them from getting the otitis media. And similarly, by they will not have the pneumococcal virus, or they will not have the disease, invasive disease that we can have in the future. So I don't know where the link between the AMR, which is antimicrobial resistant, and COVID vaccination. But yes, zoonotic diseases have been there all the time. We have so many diseases that have been, the origin of these diseases have been animals. As I said, even right now in COVID, we are not sure where is the origin of the disease. Is it the bat? Is it anything else? We don't know. MERS-CoV is the same. Middle East coronavirus. We have many people who are talking about bats can be the origin of the disease. But for antimicrobial resistant in particular, yes, it's a huge problem that we need to tackle, and there is much of effort that have been done by multiple organizations to tackle the antimicrobial resistant. And this is what I have to answer. Maybe if he clear up his question more, so I can answer him in a better way, maybe.
Thank you. Dr. Laith, about mRNA vaccines, what about the immune diseases where the mRNA will not target particular cells and the spike can grow in any type of cells where the antibody can attack it?
Yeah, I'm not sure if I see the question, if I understood the question, but maybe a different way, whether the vaccines will work in specific people, such as people with immune issues, like immunosuppressed and immunocompromised and so on. So in fact, we have done a study here among kidney transplant recipients using both Pfizer and Moderna. And because those patients have issue in the immune system because they are taking drugs to suppress the immune system. So they were worried maybe they will not build the immunity. And it turned out they eventually develop good protection using the vaccine, not as high as the rest of the population. And the development of the protection takes time. They need actually more weeks after the second dose to reach that level of protection. Yeah, but the results still are very encouraging because it means even those persons whom we are very worried about turn out to develop good level protection using the vaccine.
Okay. Are there any big differences between mRNA, the new technique, and the traditional vaccines when it comes to safety and efficacy?
So far, the mRNA vaccine seems to be also the most safe in terms of side effects. So blood clotting, for example, it was really more for the Johnson & Johnson and AstraZeneca. The only little actually side effects, I would say, cause some concern for mRNA vaccines is heart inflammation among younger people. There were actually cases which were linked to the mRNA vaccine. And this is, by the way, one of the reasons why we continue to delay the decision about giving the vaccine to younger persons, younger than 12. The FDA, by the way, even though they have a lot of data right now, they asked both Pfizer and Moderna to expand their studies to much larger size because these things are very, very rare. I mean, with the original size, they may not see such side effects. As a result of this, we need now to wait longer before we can see the results and be able to license the vaccines to younger persons. So really, the mRNA so far seems to have the best safety profile, apart from this heart inflammation, which is very, very rare, by the way. Yeah. And usually also not really harmful. For younger persons, yes. Correct.
Yes, and now we will have vaccines for the even younger.
Yeah, exactly.
And Pfizer. Is this an
correct.
issue?
Yeah, so this is exactly what delayed the decision so far.
Okay.
The FDA asked to increase the sample size in the studies that Pfizer and Moderna are doing to ensure to extent where we can really tell that these things are extremely rare. Yeah, just to be on the safe side. Yeah.
Okay. Thank you so much. By coming to the conclusion of this discussion, of course, I would like to submit my due thanks to each and every one of you. I personally have learned a lot. As we have seen in the discussion, science is very central. We cannot speak about ethics without having good science on the table. I hope that we could clarify at least some of the questions that people had in mind. We will put this on the meeting, the panel on our website. It's possible also that Wish and other forums will put them on their website as well. So the whole content will be available for the general public. One last thing, someone asked about your recent publications. I suppose there was one in the New England Journal of Medicine, and the other one was in Nature, isn't it?
Yeah, Nature Medicine. Yeah, correct. Yeah.
Okay.
Yeah, and these things are really accessible and to the public. I think just Google Scholar. It could be my name or Qatar vaccine, etc. Many will appear. Yeah. Yes. And several, in fact. Yeah.
Thank you so much. I would conclude this by giving you the opportunity to say few words as a conclusion for our discussion. Let's start this time with Mah.
My conclusion, there was a question you missed actually, and it was on the power of social media. So
Yeah,
my concluding remark is that
I must have mentioned it. You can answer it now.
yes, on the power of influencers and leaders showing that they're being vaccinated and how important that is in vaccine uptake. I
Okay,
mean,
I
social
must have
media.
missed it. Yeah.
Social media has been proven to have an effect on mental health, on physical health, on eating habits and disorders. So it for sure does have an effect on COVID and COVID vaccine uptake. So I think my message is that if you are convinced that vaccinating against COVID is the right thing to do and you have the science to back it up, then do be more vocal about it so that more people can learn about it and so that you spread the word.
Thank you so much. Dr. Khalid?
Yes, firstly, I want to thank you for this opportunity. I think this session is one of the session to tackle the hesitancy regarding vaccination, to make it clearer for everybody what's going on. I believe that everybody need to have the right information to make the right decision. And as I said before, clock is ticking. We are in a war. I don't want to put it in, but it's between infection and injection. So let's the injection win. So this is for better public health approach for our community to get back to normal, inshallah.
Thank you. Your life?
Just again, also really to thank for the great such discourse, which is bringing different perspectives, very, very interesting. And really just to stress exactly, Dr. Khalid, it's a message. It's really a war between us and the virus. And the only fundamental intervention that we have right now is the vaccination. We need to we need to distribute these vaccines equally everywhere for everyone to have the right to vaccinate. And we need to do it fast enough before the virus evolves further into more serious forms. And we have seen just how much it has evolved already. We started with the original virus, and now we went to alpha, beta, gamma, delta, and so on. And it's not going to stop till we vaccinate a sufficient number of people to be able to stop this virus from more transmission. Thank you.
Thank you so much. And I would like to thank you again and thank the organizers, the co-organizers, and everybody I mentioned by the beginning of this event. And hopefully we will see each other again and meet again on future activities and events, inshallah. Thank you so much. And thanks for those who attended this event, who shared their questions and their thoughts. Very grateful and thankful for them. Thank you so much and have a great evening and great day, everybody. And we welcome you hopefully on future events. Thank you so much.
Thank you.
Thank you.
very
Have
much.
a great evening.
Assalamu
Thank
alaikum.
you. Bye-bye.